Well, hi guys, Jeremiah with Dr. Bruce again. Dr. Bruce, this was a PDF that you showed me a couple days ago that came out by the White House. Actually, our government put this one together about how to open up America again. I wanted to kind of go through that with you.
Yeah, absolutely.
So there's the cover page of it. The challenge is this is the first time in history that the U.S. government has ever scaled a testing regime to meet the massive needs of a nationwide pandemic.
Can I tease you just right
I
here?
know. I read it exactly the way it was, but yes, go ahead.
It's regimen, folks.
Yeah.
It's regime means
Regime.
authoritarian government, right? Which I'm not so sure
Yeah.
isn't true here, but that's
Yeah.
not the goal, right? This isn't supposed to be political.
I know.
We're trying to get people back to work, you know.
Yes.
All right.
Yeah. So
Regime?
testing regime.
Regimen. It's a regimen.
Talking about mobilizing all of our resources, federal, state, and then, interestingly enough, the private sector.
Boy, have they
And
stepped up.
We'll
huh?
talk a little bit about that
Yeah.
in a second.
It's good.
So they put together an 8-part plan,
Mhm.
and this is how to get people back to work, basically.
Yeah.
So talk about number one. There's some things on here I know we've already done, but building a foundation for diagnostic testing.
Finished. Yeah, we know how to do this. This isn't our first rodeo with even a SARS virus, so
Yeah.
we know how to do it. And so right now they're basically figuring out the backbones of all of those things. But the testing out there is actually quite good.
Yep.
You'll hear all kinds of stories because some tests do come out of China and whatever that is, and we're not happy with those, or the FDA isn't.
Yeah.
That's fine. Then the FDA shouldn't approve those at all. That's okay. Let's keep it here if that's what you want to do. There's smart people all over the world, folks. But if you want to keep it here, don't you think? I think it's all right.
Yeah.
But then let the private sector go ahead and start mobilizing these tests. I think it's
Mobilize
great.
the tests for those, and
Yeah.
then we've talked a little bit about issuing emergency
Yeah.
authorizations.
Yeah.
That's been a struggle.
It's actually been some
So-
pressure put on the FDA. That's what's happened.
Yeah.
This is pressure that's being put on the FDA to say, look, is this a qualified lab? Are they using
Yeah.
FDA approved resources to make this material and then just test it, get their information? Well, usually the FDA has this ability. They're underfunded and underserved. They really are, folks. But here's the thing. They have this ability to really drag their feet, right? This tendency, let's say. And in this case, it's like, let's get an emergency use out there. We know this is a good lab. We know this is a good test. Their tests come out. You test them once and get it done, right? So that's what's happening right here.
Yeah. So then they want to ramp up the
Yeah.
testing
Yeah.
capacity, which obviously we want to do.
Yeah. Yeah.
Well,
Let's get I think that's how we do it. We established this Back to Work KC initiative, and I really think that it basically stems around testing. Have you ever had it? That's a different type of test.
Yeah.
Have you, and are you active now? That's a different type of test, right? So figuring out where you are in the process, I think it's not that hard. We can do it.
Yeah.
I mean, already it's there.
So you can see all the way through. There's quite a few things here that they're doing about testing the supply chain,
Oh yeah.
expanding the public and private sector testing, and then coordinating the governors for testing plans and rapid response programs. There's quite a bit that we're still having to do on this. But
Yeah, but you notice it all revolves around the test, right?
yeah.
Yeah. I mean, it's all about
revolves around tests.
And the fact is, we have those tests. Those tests
Yeah.
are available. In fact, even on this thing, it says that if you get the average test out there is about 90% accurate, that they're allowed to say is about 90% accurate. Understand how those numbers can be skewed. Every lab out there is going for way higher than that. But then they also admit that if you take two tests sequentially, it's not supposed to be. It's supposed to be subsequent, like regime.
Yep.
They meant the word subsequent. But if you take the test
Sequentially.
subsequently, they actually said sequentially.
Yeah, I know.
Anyway, it's the government. But anyway, it actually means subsequent, like 10 days later. Then it has a 99%. And there is no 100% test. I know I have patients out there that have had pregnancy tests that have been
Yep.
negative twice.
Yeah.
And they're pregnant anyway. So no test is perfect, right? But this comes very close. And to give us an idea, have you had it? Where are you in that stage of getting over it? And then, of course, the nasal swab test, which they've been so gracious as to do for free.
Yeah.
That's basically if you have horrible symptoms, they can check and see if you have it right now.
Yeah. So how does Bridge fit into this plan?
Well, we got a very good lab. Fortunately, we're a very elite clinic here, so we get the chance to work with some elite labs. We've got an elite lab that we were able to actually source these tests, the IgM and IgG test. So, and IgM is short-term memory.
Yep.
Does your blood remember? And it's a blood test. And it's rapid, 10 minutes. Does it remember getting this disease? And then, of course, the IgG has long-term memory, which means you're going to have a very low viral load if you can get it again. Question from the doctor to the layperson: can you get it again if you've already had it once?
Yes.
Isn't that true with everything?
Yes, you
That's
can.
true with everything.
You get
Why
the
is
cold
it
almost every year?
Why is that? Okay.
Yeah.
Yeah,
I
you can
know.
get it again.
I know.
Anybody can.
Yeah.
That's silly.
Yeah.
But you're immune some to it. I mean, you are. You're going to definitely have a lower viral load.
Yeah. So if you you want to get tested at our clinic, know if you've had the virus, if you have any questions about that, you can give us a call, 816-454-5433.
Yep, we have these tests on hand. They're going very well. You will have to be put on a list, though. There's only a certain
There's a
number.
wait list involved in it, and we overnight the tests here the next
Yep.
day and get you in and tested, but we need to get
10
your
minutes.
information first.
10 minutes. We get all your information, and we make sure that we document everything.
Yeah.
It's really good.
All right. Well, thanks for walking us through this test this plan by the government here.
The
and
regime
then,
that we have?
Yeah, the regime. And all the way at the bottom talks about the path forward.
Let's
they
get
want
to phase
accelerate
3, right?
testing and get us open again.
Let's get it to phase 3. Let's get this world back to doing something right. We will eventually get herd immunity very quickly. It's not a popular opinion, but it is true. We will. And then this will be another one of those things that happens, but not to everybody. In fact, to unfortunately only a few.
Yeah. Well, once again, 816-454-5433. You'll be put on a wait list, and then we get you tested to know if you've had the COVID virus or not.
Absolutely.
All right. Thanks,
Thank
Dr. Bruce.